I'm Megan Roberts, and I'm the program coordinator for Mom Supporting Moms, which is a program of SAFEchild, a nonprofit in Wake County. My program specifically focuses on serving pregnant and postpartum women. And I myself was a mom who found our group in 2014 while experiencing postpartum anxiety with my own child, and Mom Supporting Moms saved my life. Ever since, I have become an advocate for maternal mental health, and making sure women and their families are educated on this issue is one of my passions. So let's talk about the spectrum of perinatal mood and anxiety disorders. We use that term instead of postpartum depression because postpartum depression does not cover it and can really be a barrier to women identifying their symptoms and getting treatment. And while perinatal mood and anxiety disorders are the number one complication from childbirth, they're extremely treatable if women can get screened and get the help that they deserve. So, perinatal mood and anxiety disorders. That term perinatal means any time during pregnancy from conception all the way through any time during the baby's first year of life. And I want to make sure women know that it could come up any time during that first year postpartum. So it could be at 6 months, 8 months, or 6 weeks, or it could happen during pregnancy. So the first piece of that spectrum is the baby blues. Many of us have heard this term. The baby blues refers to the first 2 to 3 weeks postpartum, and most women experience the baby blues, between 50 to 80% of women. And that is due to the major hormonal shift that a woman's body is going through. She'll feel weepy, uncontrollably emotional, and not really quite sure where all those feelings are coming from. Those are normal and they should clear up on their own. But if a woman is getting to 3 weeks postpartum and not slowly starting to feel more like herself, and especially if she's beginning to feel worse, she may be moving into postpartum anxiety or depression. So postpartum depression, which we tend to hear more about, is sadness, frequent crying for long periods of time, isolation, loneliness, feelings of dread, not bonding with baby. That's more postpartum depression. However, we also have postpartum anxiety, which we see very often in our support groups. Postpartum anxiety is insomnia, not being able to sleep even when the baby's sleeping, panic attacks, excessive and constant worry, so what we call intrusive thoughts, repetitive worry on a loop in our head, and we can't stop thinking about that worry. Often intrusive thoughts are connected to harm coming to our baby. It doesn't mean we'd ever act on that. It's a product of our anxiety. So that's what anxiety looks like. I also see women versus not bonding with baby, not wanting to let anyone hold their baby, right? Being worried for anyone else to care for their baby could be part of postpartum anxiety. A subcategory of that is postpartum obsessive compulsive disorder. This can come up for women who have never experienced it before and really connected to keeping baby healthy, right? And maybe becoming obsessed with germs, hand washing, an obsession that goes beyond, a healthy one. So we can see that. And that, of course, has really become more dramatic through COVID, which makes sense, right? Wanting to keep our babies safe and healthy. Another subcategory is postpartum traumatic stress syndrome, and that can be connected to a traumatic birth. We see that often come up, whether a vaginal or a C-section birth. Women have trauma often connected to those birth experiences. And then all the way on the other end of the spectrum is postpartum psychosis. This is very rare, but it is an emergency and a crisis. This is when a woman has a break from reality, is experiencing hallucinations, having thoughts of harming herself or her child. I want to reiterate that this is very rare. 1 in 1,000 women experience postpartum psychosis, while 15 to 20% of women experience a postpartum mood and anxiety disorder. While it's very common, it can be very challenging to experience this type of mood issue during pregnancy or postpartum. So I want you to know that you are not alone, and with help you can feel better. The 3 main components of recovery Our social support, that could be a support group, that could be increased family support, that could be hiring a doula. Therapy, we can help with that. You want to find a specialized, well-trained therapist in perinatal mood. And then medication. And there are medications that are safe for pregnancy and breastfeeding. Some women need just one of those components, maybe just a support group. Some women need all three of those components. But we are here for you at Mom Supporting Moms to give you that information, to answer your questions, and to support you in whatever it is you need on your pregnancy and postpartum journey. You are not alone, and you deserve to feel well.